This is me. In this picture, I was 4 years old. This was my first time ever visiting Nigeria. My only memories of this trip were captured in photographs. When you're 4 years old, you don't remember things that well. But one thing I do remember is the stream. I remember following my cousins to the stream near my father's village, where we carelessly splashed around for what seemed like hours, not a worry in the world. I wasn't worried that the water was as brown as my skin, so polluted that I could barely see my own hands beneath the surface. When you're 4 years old, you don't worry about a lot of things. When you're 4 years old, you're probably not worried about if you will turn 5. You see, the reality is that I was 15 times more likely to reach my 5th birthday than my cousins in Nigeria because I lived in the United States. The reality is that Nigeria has the second highest child mortality rates in the world for children under the age of 5, with over 850,000 deaths in 2019 alone. The reality is that the maternal mortality rate in Nigeria is one of the highest in the world, with over 500 deaths for every 100,000 live births. The reality is that 31% of all malaria deaths in 2019 occurred in Nigeria, estimated at a total of 300,000. The reality is that the leading causes of death in Nigeria are neonatal disorders, diarrheal diseases, malaria, lower respiratory infections, and HIV/AIDS, all of which are largely preventable today. This is Nigeria's reality. With a population of over 200 million people and an annual growth rate of 2.4%, Nigeria is a young and booming country with a diaspora that spans the world. When you factor in the complicated history of British colonialism, you realize that Nigeria, as an entity, is more complex than meets the eye. The complexities of Nigeria's amalgamation under the crown have manifested in the many issues the country has faced upon its independence, and I can only imagine the extent of these effects on the evolution of healthcare delivery in Nigeria. My goal is to unearth and analyze these issues that have affected the development of Nigeria's healthcare delivery system and understand the underlying factors contributing to the poor health outcomes that we see today, more than 60 years post-independence. I wish to explore colonialism as a root cause of Nigeria's stunted economic and political development, and further, the healthcare system. I hypothesize that the current state of Nigeria's healthcare system can be attributed to poor governance and leadership, which reinforce the intertwined cycles of poverty and poor health outcomes in the country, and ultimately contribute to a lack of confidence in the healthcare system as a whole. Furthermore, while I cannot attribute all blame to British colonialism, I argue that the effects of colonialism have trickled throughout Nigeria's post-colonial history in the form of neocolonialism, internal conflict, corruption, and globalization, and are reflected today in the current state of the country's healthcare system. Nigeria's citizens deserve a healthcare system that can care for their basic needs, but with issues in healthcare capacity, funding, resources, education, and retention, it is difficult to provide the services that the population needs. To devise new solutions to these problems, we need to understand and address the underlying issues. To do this, I will be taking you along with me on my most recent journey to Nigeria, on a journey beneath the surface.
You don't have to cry, baby, you should know it's alright.
A famous philosopher once said that those who cannot remember the past are condemned to repeat it. I believe in order to find a way forward, we have to look back to 1960 and beyond. Nigeria, before colonial rule, was a very culturally diverse region with hundreds of different ethnic groups. These diverse societies had been ruling themselves independently in large centralized states like the Kingdom of Benin or the Oyo Empire, or in small decentralized states governed by local councils and chiefs. It wasn't until the late 1800s that the British began to impose its authority over the region, first in 1884 through the Royal Niger Company, and then in 1914 with the official consolidation of the northern and southern Nigerian protectorates by Lord Lugard. This amalgamation of Nigeria created a single colony under the British Crown, altering the political landscape of the region for the foreseeable future. Firstly, we see hundreds of previously independent and autonomous societies, the monarchies and gerontocracies at the societal level, being brought together under a single central administration at the federal level. The powers of local political leaders were altered under the notion of indirect rule, meaning that the British officials would govern Nigerian people through their control over traditional rulers. Secondly, we see significant changes in the healthcare delivery system under British rule. What used to be a society reliant on traditional medicines and indigenous healers was now one met with the introduction of Western medicine through the vehicle of Christianity. The first clinics were established primarily in the rural areas of Nigeria by Christian missionaries with the goal of evangelism and with the support of the British colonial masters. These Christian missions contributed heavily to the education and training of Nigerian nurses and physicians in these regions, even sponsoring the first cohorts of Nigerian physicians to complete their training in Europe. In the urban regions near the coast, the centers of economic activity, hospitals were constructed to support the large populations of Europeans and government officials that lived there. Furthermore, the introduction of Western medicine changed the validity of and discouraged the practice of traditional medicine, which was comparatively seen as primitive, paganistic, and as a threat to colonial rule. Western medicine brought about a new culture of care delivery, where people would seek medical care in established facilities as opposed to seeking out traditional healers. This westernized healthcare delivery model also placed an emphasis on bureaucracy and specialization. By creating structure and order, and encouraging practitioners to develop expertise or mastery in a specific area of health. On the other hand, traditional medicine was institutionally unstructured, or, as anthropologist Murray Last describes it, were non-systems, and indigenous healers tended to be generalists in terms of healing knowledge and performed individualized treatment on their patients. These major changes in healthcare delivery centered around Western traditions, in the same way that British colonial rule brought about a completely new structure of governance in Nigeria, Western medicine brought about a completely new system of healthcare delivery. By 1946, Nigeria was closer to having a formalized healthcare system, with the announcement of the 10-year Health Development Plan, which was the first nationally coordinated effort for health services, and the establishment of University College Ibadan's medical school in 1948 and other nursing and midwifery schools across the nation. On October 1st, 1960, Nigeria gained full independence from Britain. However, since then, most of Nigeria's recent history has been characterized by instability, economically, politically, ethnically, and systemically in healthcare. In 1960, the life expectancy in Nigeria was 37 years old, which was higher than some African and Asian countries at the time. However, as life expectancies doubled in many of these countries over the years, Nigeria has only peaked at 53 years old. It has most likely been due to the skepticism surrounding Western or Orthodox medicine, coupled with the general distrust of the Nigerian healthcare system due to its obvious deficiencies that cause delayed care and poor health outcomes. Additionally, patterns in the disparities between rural and urban healthcare have existed since colonial times, stemming from the neglect of the development of healthcare facilities in rural areas in favor of urban areas in order to serve the Europeans who were living there at the time. The establishment of the Nigerian healthcare system during its colonial period was largely molded by the interest of British colonial masters and needs to be reshaped to match the needs of the growing independent country. Today, the Nigerian public healthcare system is split into 3 tiers: primary, secondary, and tertiary, operating along the 3 levels of governance: the local, state, and federal levels. Primary care is to be provided by local community health centers, secondary care by state general hospitals and specialist clinics, and tertiary care by federal teaching hospitals or highly specialized facilities. There is still much work to be done in terms of fixing the broken referral system between levels, providing funding and allocating resources across levels, and building public-private partnerships to provide better health care for the people of Nigeria. Both of my parents are from the southeast region of Nigeria, commonly referred to as Igbo land. Of Nigeria's hundreds of ethnic groups, the Hausa, Yoruba, and Igbo tribes are the most populous. While the north is primarily Muslim, the south and southeast are primarily Christian. It's been more than a decade since I last visited Nigeria. I began my journey by traveling to my mother's village in Imo State. Her village is called Mbieri. It's the Christmas season, and my mom is giving back to the community through a nonprofit that she chairs, Ministry of Care.
And one of our goals is to cater to the less fortunate people, widows in particular, orphans, children, and people without any help whatsoever. And one of our major events is the Christmas outreach. Today we did the outreach at our headquarters, where we give to the widows and to the orphans and less privileged Christmas gift. In this case, food items, because many people are suffering. They do not have food, they do not have means to get the food they need, especially during this holiday. When women loses their husband and become widow and widower, the head of the house, the provider, is actually gone. And we have children without breadwinner and also mothers without breadwinner. The government, unfortunately, do not have any program in place to take care of these widows and orphans in regards to their health care or their needs. We provide healthcare services as well as palliative services, which is one of the activities we did today.
Christianity, for better or for worse, has undoubtedly been a great force behind the development of the healthcare system in Nigeria. For instance, in the late 19th century, the Christian Missionary Society endeavored to spread the knowledge of Christ through the provision of education, medical facilities, and training institutes for nurses and midwives, some of the earliest forms of Western medical education in Nigeria. Even today, there are many faith-based charity organizations that fill the gap of healthcare that the government does not provide. Whether the aid received is religious or secular, the needs of Nigerians has always seemed to exceed the capacity of the existing healthcare infrastructure. I admire what my mom does through the Ministry of Care. It makes me hopeful, yet still sad to think that these organizations need to fill the gaps left in care by the Nigerian government. If not for people like my mom, what would these widows do? If these people were to get sick, their first response is not even to access the primary healthcare services that the government provides. Their first response is either to remedy it themselves or go to the local chemist.
Here you go. Nice.
I need empowerment. Wow. We need empowerment.
Yeah, is there any other chemist?
No.
It's just you?
Yes.
And if the problem becomes more severe than over-the-counter drugs can handle, a study showed that 60 to 90% of Nigerians self-refer themselves to secondary or tertiary level care, completely bypassing the step of primary health care. This contributes to the broken referral system between the three tiers of the healthcare system. It is a shame how underdeveloped the primary healthcare system is at the local level, especially in the Southeast, so much so that people may avoid receiving care there. I can only help but think that the stunted development of healthcare services in this region is tied to the history of internal conflict, namely the Biafran War. The 30-month war began in 1967 and ended in 1970. Also called the Nigerian Civil War, this conflict was between the Nigerian government, which was dominated by the Hausa Fulani people of the north, and Biafra, a secessionist state of mainly Igbo people in the southeast. The attack on Biafra by the Nigerian military was led by a Yoruba man, with the goal of protecting Nigeria's control over the lucrative oil production in the southeast region. Eventually, Biafra was captured and a blockade was enacted, leading to mass starvation of Biafran people. The conflict was exacerbated by ethnic tensions and anti-Igbo pogroms, or massacres. The Biafran War was evil and bloody, with over 100,000 military casualties, but close to 2 million Biafran people died, 90% due to various diseases or hunger. As a result of the war, farmlands were destroyed and many were left in economic distress. Access to care was extremely limited as roads and clinics were destroyed and hospitals were bombarded from the air. Many suffered from diseases like cholera and kwashiorkor. Religious and secular NGOs such as Lutheran World Relief, Save the Children, and the Red Cross played a crucial role in delivering effective humanitarian aid to the affected individuals. To revamp the health sector in the Southeast, the government had to build new hospitals and renovate the ones still standing immediately following the war. My mom was just a toddler when the Biafran War began. She tells me of a time during the war when it was incredibly difficult for her family. She had 10 other siblings, and because of the regional food shortages, there was just not enough food to go around. She became jaundiced and suffered from kwashiorkor, a condition caused by malnutrition characterized by severe swelling of the abdomen. Conditions got so bad that she and her younger sister, the two youngest children of the family, were abandoned in the forest to starve to death. However, after 2 days, her father returned to save them because he loved them too much to leave them behind. She was only 4 years old. When you're 4 years old, you shouldn't have to worry about dying from malnutrition during periods of conflict in your country, and no father should have to worry about whether or not to leave his children behind. The political, economic, and ethnic tensions that led to the conflict of the Nigerian Civil War are manifestations of the effects of Nigeria's colonization, and the internal conflict these tensions caused further stunted the development of healthcare delivery and infrastructure in the region and in the country. My dad is from Abia State, which shares a border with Imo, my mom's state. My dad was born in a village called Lodu, Imenyi. He was raised by a single mother in this rural village where they farmed for a living. Even today, Lodu Imenyi remains a quiet community of people, majority of whom live in poverty nonetheless. Even the local government clinic, the Center for Primary Health Care in this community, seems to be very understaffed and underfunded.
Well, I can see that government have tried in their own way, at least giving us this equipment that is here. We are lacking, we don't have lab section here. Those things we are lacking them here. We need them here. Because most times when they come, you refer them to a lab to do a test. Then they will now come back with the results. You now treat them with their results. If we have lab facility here, we will be okay too. Then if we have infant clinic here, we'll be glad to have such thing here. There is a very big advantage as it is owned by government. At least people are accessing it in a lower rate. In a lower rate. They are accessing it in a lower rate. When you go to private clinic or private hospitals, it is very high there. But when you come to this government sector, it's very, very low.
Some progress has been made in primary healthcare development in terms of an expansion of health infrastructure to rural communities, the establishment of schools and training programs, and the increased number of community health workers. In 1988, Nigeria's first comprehensive national health policy was passed. In 1992, the National Primary Healthcare Development Agency was established to create accountability for continued delivery of primary healthcare in the nation. The Primary Healthcare Under One Roof intervention of 2011 was aimed at reducing the fragmentation of primary healthcare governance by bringing primary healthcare under the authority of each of Nigeria's 37 states and territories and under the National Primary Healthcare Development Agency. This was done to strengthen the capacity and improve the delivery of quality primary care. While progress is slowly being made in the realm of primary health care, Nigeria is also working to provide health insurance. Through the National Health Insurance Act of 2022, healthcare insurance in Nigeria was made mandatory, legislation designed to promote the private-public collaboration in healthcare service provision and to accomplish universal health coverage for all, so that people can access a full range of quality health services without having to encounter financial hardship, so that Emilia's daughter can get the help that she needs, from basic healthcare to specialty healthcare.
In this community now, there's no good equipment to help at least mothers during delivery. Difficult ones, they cannot manage it there. That incident happened during the pregnancy. From 4th month, I started having issues. During delivery, we noticed the problem. Her leg was on her tummy. 3 days after birth, we went to UNTH where they operated that thing. Those things affected her on the leg. She cannot walk alone. You can't manage her anyhow unless you will go to that Enugu where the specialists are. So you cannot take her now to health center. Health center cannot manage her case. So if she has crisis now, we will rush her to UNTH. That's where they know the history.
Umuahia. My dad lived in this town for some years before he emigrated to the U.S. for college. He's told me the story about how he got the scar on his stomach. It wasn't very long after he arrived in the States that his appendix ruptured. He was rushed to the hospital and had an emergency open appendectomy. He lived, of course, but it just makes me wonder. If his appendix were to have ruptured while he was still in Nigeria, would he have made it? Would he even be alive? Would I? The lack of basic healthcare services and the general distrust of the healthcare system have the potential to transform simple health issues into life-threatening ones. Too many people die every day from preventable conditions. With the ever-increasing prevalence of non-communicable diseases in Nigeria, there is an increasing need for a skilled healthcare workforce to take care of a diverse array of conditions. Since colonial times, there has always been a great disparity between the available healthcare resources in rural and urban parts of Nigeria. Let's see what differences exist by exploring the capital city, Abuja. Welcome to Abuja, the now capital of Nigeria, as of 1991. The city is situated in the heart of the country, in the Federal Capital Territory, with a growing population of over 3.5 million people. Getting access to quality care in the city is so much easier than in rural areas. Here, you have many facilities to choose from, your choice of the healthcare provider, high-quality care delivery, and not to mention better roads and methods of transportation. Today, Nigeria has a growing for-profit private health sector that is heavily concentrated in major cities such as Abuja, Lagos, Port Harcourt, Kanu, Enugu, and others. Similar to the public sector, the private sector includes primary, secondary, and tertiary care facilities, as well as private pharmacists and traditional medicine practitioners. Presently, the private sector provides a majority of the healthcare services in Nigeria. Due to the inadequacies and distrust of public health facilities, many patients are driven to seek care from private facilities. For this reason, barriers to entry in the private healthcare market are low. However, this can cause a big issue: ineffective state regulation of private practices, meaning the field is less regulated. To understand more about the differences between public and private healthcare delivery, I wanted to speak to a variety of doctors and specialists and get their perspectives. I began at the National Hospital of Abuja and spoke to Dr. Regina Morgan, an eye specialist.
We don't have enough equipment to work with, especially in the government sector. I don't know much about private sector because I haven't been into private practice much. But in the government sector, even when you want to work, the equipment is lacking.
The main issue has to do with government funding. Very little is given to the health sector, right, compared to some other sectors.
Some of the challenges sometimes that people may face is, timely care, especially in emergency situations.
Well, the healthcare system in Nigeria, especially when it comes to the public sector, it's very, very bad. I feel the only place that has really good healthcare systems should be Lagos State. That is Lagos State University. Abuja National Hospital Abuja is trying, but I feel it's not enough. But when we come to healthcare systems that are actually good, we talk about the private sector. And then the public, the general public, the poorest of them all cannot really have access to this healthcare system, which is really bad because the percentage of people who are well-to-do in Nigeria, it's like 1 to 99%, which is actually it's really, really bad.
The motivation to want to put your skills into practice is lacking. Nigerian doctors are not motivated enough, especially those in government practice, to want to go on to specialize and to remain in Nigeria even when they specialize. I'm sure you know that many Nigerians are all over. There are many. The best hands you have in US and in Europe, yes, medical professionals and Nigerians.
So as many more people who have that exposure return, that also is going to improve. And once that improves, the experience of the Nigerian patient would also improve. And in fact, we would then not have a need for a lot of the medical tourism. Because it's not just the lack of staff or equipment, but also the attitude. When people are sick, they want to go where they are treated with a lot of respect. And we sometimes don't find that in our facilities here.
And, just general empathy sometimes from the healthcare staff, but you can kind of understand when people are frustrated and they're having a difficult time themselves, it can be harder for them to be empathetic or, want to be helpful in certain situations.
Our doctor-to-patient ratio in Nigeria is very, large. Like we have over 1,000 persons in this country to be catered for by one doctor.
And specialization is very key because you cannot remain with the basic medical certificates or skills to be able to provide the high standard of medical care that our people need and they deserve. We need to compare with what obtains in other parts of the world.
But there's still a big need for us to get more people into getting specialized to be able to provide care to Nigerians.
That's like residency training, you mean? Yes. We should improve conditions for residency training. Many more centers should be opened because there are many Nigerian doctors graduating who want to go into specialization, but the vacancies are limited. So if we can have more spaces, many more people would want to go in.
If we have leaders that are willing to put in their best for us to get good health in Nigeria, I think it would really go a long way. Yes, because I think the problem we are having in Nigeria is mainly people don't see health as something that is very important, or because they have access to going outside the country to get the health, then they feel, okay, those that are in the lower class should not be taken care of. You can go to, let's say, primary health care in rural areas. They are nothing to write home about. You get there, you will not see doctors, you will not see nurses, and it's very painful.
The other thing is on I think corruption, not just in the government, but also in the health sector.
Not be the one way then go tell them, say, don't mind that. I don't know what is wrong with him. Is it his father's money? It's government money. Oh, we say you are stealing. No. It's government money. It's nobody's money. Before then they thief in millions, now in billions.
From what I hear, a common theme is the dissatisfaction in the healthcare system itself, stemming from patients' limited access to primary and specialty care and providers' lack of funding, resources, and training. And the brain drain is a prominent result of this. Since the economic downturn and the health budget cuts in the 80s and 90s, the phenomenon of the brain drain continues to attract Nigeria's skilled healthcare workforce to better paying jobs in higher income countries, like in Europe or in North America. Another result of this general dissatisfaction is medical tourism, attracting those who can afford to travel abroad to receive care to do so. Ironically, many of those who participate in medical tourism are the politicians who are responsible for improving those same healthcare services within the country. Nigeria is notorious for corruption. Although the legacies of corruption have left a deep stain on the fabric of the country, it does not have to remain Nigeria's identity. There has to be a way to replace this fabric of bad governance with one of ethical governance and suitable leadership. It is no surprise that the current state of Nigeria's healthcare system, the country as a whole, is poor. The problems are clear: poverty on an individual level and on a systems level, and poor governance and leadership. Poor governance and leadership reinforce the cycles of poverty that exist in the country, which ultimately leads to poor health outcomes. This continuous cycle is what leads people to have a lack of confidence in the healthcare system, on a provider level and on a patient level. Having a lack of confidence in the healthcare system is where we are, but it's not a dead end. If we can revive this hope from the ground up and effectively motivate our healthcare workforce, we can see the improvement in the Nigerian healthcare system that we wish to see. I propose 4 main solutions to further the development of healthcare delivery in Nigeria. Number 1, increase accountability. Nigerian leadership needs to be held accountable for its performance and prioritize health as a fundamental human right. Proper leadership is important to make the necessary changes, and there needs to be a zero-tolerance approach to corruption. Number 2, strengthen public-private partnerships. The public and private health sectors should not operate in silos. Instead, Nigeria needs to create more opportunities for the collaboration of both sectors in order to deliver high-quality, sustainable care and improve healthcare outcomes across the nation. Number 3, develop self-reliance. Nigeria needs to build self-reliance as a country and as a healthcare system by means of bolstering its infrastructure internally to be able to meet the country's increasing demands. This would entail increased health spending in order to provide adequate financial support to primary healthcare facilities, improve health supply chains and resource availability, and train and retain a sustainable health workforce. And number 4, invest in people. If Nigeria hopes to prosper in the future, it needs to invest in its most valuable asset, its people. We should invest in the refinement of our human resources at home. Reversing the brain drain starts by plugging the source of the leak. Protect, educate, and empower the youth and keep them healthy, as they will soon become our future leaders in healthcare, in academia, in government, and in culture. As a Nigerian in the diaspora, I wonder at times if Nigeria is even mine to worry about. But then I think it's not a matter of whose problem it is, as much as it is a matter of who's going to fix it. And if you believe that Nigeria should be the one to fix its own problems, and you identify as Nigerian, then Nigeria is your problem. Nigeria is my problem. Even considering the complicated past of Nigeria's inception, the lumping together of hundreds of tribes and tongues under one rule, Nigeria has a rich, unique, and kaleidoscopic history. It's one that's littered with evil and corruption, colonialism and international affairs, civil war and tribalism, religious conflict and mass exodus. But it is also one abounding with culture and creativity, scholarship and advancement, innovation and ingenuity, resilience and pride. This is Nigeria's reality, and it's still becoming something beautiful.
Since this is our only country, we must find a way to improve the health system. If we don't do it, nobody will.
There are ways you can better the health system, whether or not you are in Nigeria. It doesn't really matter. You decide to go to any other country or you decide to come back to Nigeria. I think it has to do with personal reasons. They are personal. It should be personal.
North, south, east, or west, home is the best. I always say that wherever you are, whatever you're doing there, as long as you're not affecting your own people, you haven't achieved anything.
Okay, if it's not, for me, it's not just enough that we know that there is a problem in our healthcare system. It is important that we change it. And I'm actually using that as an opportunity. I would want to be that change. I would want to make a difference in my own little way. So if I'm a biomedical engineer, I'm actually learning. So definitely, and if I learn my skills in biomedical engineering, I'll try to see how best I can use it to help improve the health sector of my country. So definitely, I want to make a change. And even if it's just one person I can impact on, then for me, it is good enough.
We only need to come together, agree upon, and act upon the solutions that will improve the conditions of the country. We cannot keep going around in circles, nor can we let the legacies of colonialism and a history of bad governance keep us from finding a clear road ahead. I believe that the future is bright for Nigeria. It might be hard to see at the moment, but we just need to take a deeper look beneath the surface.
I do what I want, I do what I like, I know what face, I no fear nobody, nobody. I do what I want, I do what I like, I know what face, I no fear nobody, nobody.